Before you become an acute care nurse practitioner, it's crucial to understand the types of jobs that an acute care nurse practitioner can do. These are 7 different jobs that an acute care nurse practitioner can do. Hi friends, my name is Ahmed Mirza. I'm a nurse practitioner currently practicing in the emergency department and in the urgent care. Number 1, a hospitalist. As an acute care nurse practitioner, you could be the provider in the hospital that is admitting patients from the emergency department or direct admissions from a different facility. So the way it works is patient comes into the emergency department, they get evaluated by the emergency provider, and if it's determined that this patient needs to be admitted, the emergency provider will contact the hospitalist and discuss this case and see if the hospitalist agrees with admission. If they do agree, patient will then be admitted under the hospitalist care. So the whole time the patient is in the hospital, they're being managed by the hospitalist. Now, if the patient needs a specialist, like for example, they came in for chest pain and they need to see a cardiologist, or they need to see some other kind of specialist, then the hospitals can consult those specialists to bring them into the case and help out take care of this patient. But ultimately, the hospitalist is the main person that's in charge. They're the person at the end will discharge the patient to home. A lot of these nurse practitioner hospitalists will work schedules similar to 7 days on, 7 days off, 12-hour shifts. Some of them work Monday through Friday, just kind of depends on the job itself. Number 2 is critical care. Critical care typically means seeing patients that are the sickest of the sick, oftentimes in the intensive care unit and sometimes in step-down units. A lot of these patients are intubated, extremely sick, have multiple problems, are on a lot of medications, a lot of IV medications. They're on vasopressors to keep the blood pressure up. A lot of these patients also are status post after major surgeries or major traumas. So you'll be one of the providers seeing the patients, being in charge of the patient in the ICU. Usually you're working in collaboration with other providers like ICU doctors. You'll follow these patients day in, day out while they're in the ICU, and then once they're stable enough to be discharged out of the ICU, you can transfer them out of the ICU. A lot of times these providers will work shifts, sometimes 12-hour shifts. Sometimes it's an 8 to 5 Monday through Friday job, just kind of depends on where you go. Number 3, surgery. You can join a team of surgeons, either general surgeons or orthopedic surgeons or different kind of surgeons. You'll typically do a lot of rounding in the hospital, see the patients before doing the surgery and following them after the surgery, determining when they can be discharged to home, doing small procedures, for example, removing chest tubes, or seeing patients in the medical office as well and doing small procedures in that office. If you go on and do advanced certification, you can become a first assist and help the surgeon in the actual OR. Number 4 is rapid response. This is typically working in a hospital whenever there's a patient that's on a general floor like med surg, anything that's not ICU or not the ER, and they start to decompensate, meaning the blood pressure becomes really low, they become lethargic or unresponsive, or if they code and they need CPR or they need ACLS, then usually the nurse or whoever is there would call a rapid response code, and the rapid response team would come and you would be on that team. You would stabilize the patient, intubate if you need to, you do ACLS. Once you stabilize the patient, then you can transfer them to a higher level of care like the ICU. Number 5, in some cases you can work in the emergency department as an acute care nurse practitioner. Now, that's not the gold standard. Usually most ERs want family nurse practitioner, or if you're certified as an emergency nurse practitioner, but some hospitals have a separate adult ER and a separate peds ER. If you're an adult acute care nurse practitioner, then you could work in the adult ER. And if you're a pediatric acute care nurse practitioner, you can work in a pediatric emergency department. In general, if you're interested in an emergency department, you should pursue either family nurse practitioner or emergency nurse practitioner. Number 6 is any inpatient specialty. For example, cardiology, nephrology, gastroenterology, neurology. As an acute care nurse practitioner, you could be working on this team and see patients in the hospital. You can run on these patients, you can do the initial consult. For example, that chest pain patient that was admitted, the hospitals will call the cardiologist. You may be the one that responds and goes and sees the patients and does the rounds and puts in the orders for those patients. And the same thing with GI and those other specialties. You may also see patients in the clinic and do runs on patients in the hospital. Number 7 is trauma. Usually trauma hospitals have a designated trauma team. including surgeons and other physicians and nurse practitioners. So you could be the provider that responds to trauma cases when they present to the emergency department or when they're transferred from another facility. You can assist in rounds, you can assist with procedures, intubations, chest tubes, other procedures, and following these patients while they're admitted in the hospital. Acute care nurse practitioners in general work inside a hospital or other acute care facilities. Another attractive aspect of acute care nurse practitioners is that they oftentimes perform advanced procedures like intubation, chest tubes, central lines, arterial lines, and many others. If you enjoyed this video, check out this video about 6 jobs that a family nurse practitioner can do, and this video about whether or not becoming a nurse practitioner is worth it. Talk to you later. Bye.